Good evening. This is All India Radio and I am Sanjay Mattu with the news at 9. The headlines. Prime Minister Narendra Modi assures citizens of every possible help in view of COVID-19. Government keeps a strict watch on availability of testing kits, medicines and isolation wards. 195 more Indian nationals reach Jaisalmer from Iran by special plane. Last batch of 185 Indian pilgrims in Jeddah on way to Mumbai. CBSE directs board examination centres to ensure sitting arrangements with adequate distance between students. Yes Bank resumed all banking services this evening. In Jammu and Kashmir, free of cost health cover to be provided to all residents under Ayushman Bharat. Prime Minister Narendra Modi today asserted that the government will do everything possible to help citizens in view of the outbreak of COVID-19. Replying on Twitter to many tweets posted from a cross-section of people, Mr. Modi lauded all those working to make it possible and said no words will ever do justice to their exceptional efforts. Replying to a tweet by a news channel quoting a person who lauded the government for rescuing his daughter from Italy, the Prime Minister said that such efforts are possible due to teamwork. He also urged researchers, innovators and tech lovers to rise to the occasion and ideate for a better planet. The Prime Minister also appreciated Odisha Chief Minister Naveen Patnaik for registering his sister's details on a government portal for persons coming from abroad. Mr. Modi expressed the hope that others also emulate Naveen Patnaik and do their bit in preventing the spread of COVID-19. The Health Minister, Dr. Harshvardhan, today chaired a high-level review meeting on the spread of the coronavirus with senior officials of the ministry and medical superintendents or directors of central government hospitals in New Delhi. The minister appreciated the various actions being undertaken in close coordination with various ministries at the central level, states, as well as Indian embassies abroad. He also lauded the states for active surveillance, effective contact tracing, and their preparedness for containment and management of COVID-19. Dr. Harshvardhan reviewed the preparedness and directed hospitals to ensure adequate availability of protective gear for all healthcare workers. He also reviewed in great detail the quarantine facilities for evacuees, including the ones at airports or other key transit points. The Health Minister has directed for teams to be deputed to regularly inspect and monitor the quarantine facilities to ensure that the necessary amenities and facilities are being provided. The Minister said he'll be reviewing the same every day with the aim of improving them. Dr. Harshvardhan has also advised the use of multimedia communication campaigns to focus on preventive measures, busting myths, and equipping the masses with information on guidelines, advisories, and testing labs. The Director General of the Indian Council of Medical Research, ICMR, Dr. Balram Bhargava, has said ICMR is setting up 2 rapid testing laboratories at different places. These labs will have the capacity to test 1,400 samples a day. They'll become operational by the end of this week. He said ICMR is also engaging with high-quality private laboratories that include accredited laboratories to understand the modalities to increase access to COVID-19 tests while ensuring appropriate safeguards. Dr. Bhargava said at present there are 72 functional laboratories in the ICMR system, and it has also engaged other government laboratories which include CSIR and DRDO. 49 of these labs will start testing by the end of this week. Dr. Bhargava said all asymptomatic patients who have taken international flights in the past 14 days should get tested if they develop symptoms. He said that the country has not yet seen community transmission of the novel coronavirus outbreak, and India continues to be in stage 2, which is local transmission. The total number of confirmed cases of coronavirus in the country has now reached 147, including 14 who are now COVID-free and 3 reported deaths. The third batch of 195 Indians from Iran were brought to Jaisalmer by a special plane this evening. With the arrival of this batch of evacuees, the total number of quarantined people housed at the Army Wellness Facility in the Jaisalmer military station has risen to 484. Defence spokesperson Colonel Sombit Ghosh said that they were screened at the airport and shifted to the Army Wellness Facility at the Jaisalmer military station. Army authorities have confirmed that all the quarantined persons are stable. The last batch of 185 Indian pilgrims in Jeddah left for Mumbai today by a special Indigo aircraft. The Consulate General of India, Jeddah, said that with the departure of these pilgrims from Jeddah, the final phase of evacuation of 3,035 Indian Umrah pilgrims culminated today. More from our correspondent.
More than 3,000 Indian Umrah pilgrims have been evacuated from Jeddah in the past few days. The last batch of 185 such pilgrims left from Mumbai in the special aircraft this afternoon. Speaking to AIR News, Consul General Noor Rahman Sheikh in Jeddah thanked the Ministry of Civil Aviation, all the airlines and Saudi Arabia for their timely support in the evacuation effort. To mitigate the spread of COVID-19 in Saudi Arabia, the kingdom has temporarily suspended the Umrah, the year-round pilgrimage to the holy cities of Mecca and Medina. It has also suspended the international flights for the next 2 weeks. Kanchan Prasad, AIR News, Dubai.
The Indian Navy has upscaled its Infection Prevention and Control, or IPC, activities to deal with novel coronavirus infection. 44 evacuees from Iran are under quarantine at the Indian Navy quarantine camp at Ghatkopar in Mumbai and are asymptomatic. Quarantine camps are also being readied at Vizag and Kochi. The Indian Army, which reported its first case of coronavirus in Leh, today announced suspension of war games, conferences and training activities as part of precautionary measures. The Army has also stopped recruitment drives across the country, including the Service Selection Board or SSB exams. The Army has also placed soldiers under quarantine on their return from leave. The Indian Air Force too yesterday announced postponement of the Air Force exams which were scheduled later this week. The Union Territory of Jammu and Kashmir is also taking all measures to contain the spread of COVID-19. A report from our Srinagar correspondent.
Mata Vaishno Devi pilgrimage in Katra has been closed with effect from today, and operations of interstate tourist vehicles, both incoming and outgoing, have been banned by the administration in an effort to contain the spread of coronavirus. It has also banned the entry of the foreign tourists into the soil of Jammu and Kashmir. The UT administration has also urged the general public to maintain social distancing and hygienic standards, since it would go a long way to curb the spread of this contagious threat. It is now evident that J&K administration is making all-out efforts to keep at bay this pandemic from entering into Jammu and Kashmir. Sunil Kolf, AIR News, Srinagar.
The Central Board of Secondary Education, or CBSE, has directed board examination centres to ensure sitting arrangements with adequate distance between students to contain the spread of the coronavirus. In the advisory, the CBSE said that it will be the responsibility of examination centres to ensure that candidates for board exams are seated at a distance of 1 metre from one another. Wherever the size of the room does not permit that, the examinees can be split into other rooms. It said the exam invigilators should wear masks or cover their faces with handkerchiefs during exams. The government has earmarked 25 private hospitals with clear instructions for strict check of COVID-19 infection. Talking to AIR News exclusively, Chairman and Head of Cardiology Department of Max Group of Hospitals, Dr. Balbir Singh said that affected persons will be referred to government hospitals for treatment.
गवर्नमेंट ने इंस्ट्रक्शंस बहुत क्लियर दिए हैं। 25 हॉस्पिटल ईयर मार्क किए हैं दिल्ली में, उनमें से हमारा हॉस्पिटल भी है। हमारे हॉस्पिटल्स में क्लियर इंस्ट्रक्शन है, जो भी आदमी एंटर करता है उसके हम टेम्परेचर चेक होता है, उसका ट्रैवल हिस्ट्री पूछा जाता है, कोई सिम्टम्स तो नहीं है, हैंड सैनिटाइजर दिया जाता है, और अगर इनमें से कुछ भी पॉजिटिव आता है तो उसको हम गवर्नमेंट हॉस्पिटल भेज के टेस्ट जरूर कराते हैं।
In the wake of the growing COVID-19 cases in the country, the Health and Family Welfare Ministry has issued an advisory for the people. It focuses on social distancing, hand sanitation and restriction of mass gatherings with a view to contain the spread of the novel coronavirus. Here's a report.
The Ministry of Health and Family Welfare has advised people to follow basic protective measures to keep themselves safe from the novel coronavirus. People should avoid participating in large gatherings. If a person is experiencing cough and fever, he or she should avoid close contact with others. People are advised not to touch their eyes, nose and mouth without cleaning their hands. Spitting in public places should be avoided. All persons should practice frequent hand washing with soap and water or use alcohol-based hand rub. Used tissues should be thrown into closed bins immediately after use. In case of fever, difficulty in breathing and cough, a doctor should be consulted immediately. The Health Ministry has issued a toll-free number 1075 for the public for inquiry about coronavirus. It has also issued an email ID ncov2019@gmail.com for any assistance on the pandemic.
The News Services Division of All India Radio, in its bilingual live phone-in program tonight, will bring you a discussion as part of the Corona Jagrukta series. Padma Shri awardee Dr. Mohsin Wali and Dr. Madhur Yadav, Director and Professor Medicine, Lady Hardinge Medical College, will participate in the discussion. Listeners can ask questions to the experts sitting in our studio on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle @AIR News Alerts by #AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:30 p.m. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. This is All India Radio giving you the news. For quick news updates, visit our News on AIR app and follow us on Twitter @AIR News Alerts. You can also visit our website, newsonair.com. Yes Bank has resumed operations and all its banking services are available for its customers now. The bank in a tweet said that its banking services are now operational and the customer can experience the full suite of its services. Yes Bank said its branches will open 1 hour earlier at 8:30 a.m. from tomorrow to the 21st of March. It has also extended banking hours across branches for senior citizen customers from 4:30 p.m. to 5:30 p.m. till the 27th of this month. In Jammu and Kashmir, Lieutenant Governor Girish Chandra Murmu has accorded sanction to rolling out the Jammu and Kashmir Health Scheme. Under the scheme, free-of-cost universal health coverage will be provided to all residents of the Union Territory in convergence with Ayushman Bharat PMJAY. Around 1.25 crore residents of Jammu and Kashmir will benefit under the scheme. Under this universal health coverage, the beneficiary shall be entitled to free health insurance cover of 5 lakh rupees per family per year on floater basis, and there is no restriction on family size, age or gender. The Supreme Court today refused to accept the plea for producing 16 rebel MLAs of the Madhya Pradesh Congress in the judge's chamber and observed that they may or may not go to the assembly, but they cannot be held captive. The bench was hearing cross-petitions filed by senior BJP leader Shivraj Singh Chauhan for an immediate floor test by the Kamal Nath government after 22 rebel MLAs of the ruling combine purportedly resigned. The bench also refused to send its Registrar General to meet them and deferred the hearing for tomorrow 10:30 a.m. Former Madhya Pradesh Chief Minister and senior Congress leader Digvijay Singh was taken into preventive custody today in Bengaluru when he sat on a dharna outside a private resort where rebel Congress MLAs are camping since the beginning of this month. After his release from police custody, Mr. Singh gave a petition to the police to allow him access to these MLAs to seek their vote for his election to the Rajya Sabha. However, the rebel MLAs have sought the protection of the police and released a video grab saying that they will not meet Digvijay Singh as they have already resigned. The BJP has requested the governor to immediately stop appointments and arbitrary decisions being made by the Congress government. The state cabinet took several important decisions, including creation of 3 new districts in Madhya Pradesh. And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi assures citizens of every possible help in view of COVID-19. Government keeps a strict watch on availability of testing kits, medicines and isolation wards. 195 more Indian nationals reached Jaisalmer from Iran by special plane. Last batch of 185 Indian pilgrims in Jeddah on way to Mumbai. CBSE directs board examination centres to ensure sitting arrangements with adequate distance between students. Yes Bank resumed all banking services this evening. In Jammu and Kashmir, free-of-cost health cover to be provided to all residents under Ayushman Bharat. And for details of these stories and more, log on to our website, newsonair.com. And that's all in the news at 9. Good night.